Tunneled pleural and peritoneal catheter insertion is performed as a treatment option for recurrent pleural effusion or ascites. Insertion of tunneled intraperitoneal catheter, e.g., dialysis, intraperitoneal chemotherapy instillation, management of ascites, complete procedure, including imaging guidance, catheter placement, contrast injection when performed, and radiological supervision and interpretation, percutaneous. The physician places a tunneled intraperitoneal catheter for drainage, dialysis, or chemotherapy instillation using a percutaneous approach. The physician makes a small abdominal incision, opens the peritoneum, the double-layered sac covering the internal organs and lining the abdominopelvic walls, and inserts the catheter into the cavity. The proximal end of the catheter is tunneled subcutaneously away from the initial incision and brought out through the skin. The incision is closed. Alternately, the physician may percutaneously insert the catheter over a wire placed through a needle inserted into the peritoneal cavity. This code reports the complete procedure and includes placement of the catheter under imaging guidance, contrast injection if performed, and radiological supervision and interpretation. Insertion of tunneled intraperitoneal catheter, with subcutaneous port, i.e., totally implantable. A permanent intraperitoneal catheter with the reservoir is inserted subcutaneously for continuous drug infusion. In the case of a totally implantable, intraperitoneal insulin delivery system, the pump reservoir is inserted under general or local anesthesia into a surgically prepared pocket in the subcutaneous fat of the lower or mid-left abdomen. The infusion line catheter from the pump is placed inside the peritoneal cavity with the tip free moving. Insertion of tunneled intraperitoneal catheter for dialysis, open. The physician places a permanent intraperitoneal catheter for drainage or dialysis. The physician makes a small abdominal incision, opens the peritoneum and inserts the catheter into the abdominal cavity. The proximal end of the catheter is tunneled subcutaneously away from the initial incision and brought out through the skin. The incision is closed. Insertion of subcutaneous extension to intraperitoneal cannula or catheter with remote chest exit site. A permanent, subcutaneous intraperitoneal catheter is lengthened with an extension and brought to the surface of the skin during the primary procedure in which a catheter/cannula is established. In the primary procedure, the physician makes a small abdominal incision, opens the peritoneum, and establishes the cannula. The physician fits an extension to the cannula and tunnels subcutaneously to accommodate the extension. The physician makes a separate incision in the chest as an exit site for the extension. The extension is brought out through the skin and may be attached to the drug delivery system. The operative incision is closed. Delayed creation of exit site from embedded subcutaneous segment of intraperitoneal cannula or catheter. A previously implanted, permanent subcutaneous intraperitoneal catheter is brought to the surface of the skin. The physician makes a small abdominal incision, opens the peritoneum, and locates the end of the existing intraperitoneal cannula. An extension may be fitted to the existing cannula. The physician makes a separate incision as an exit site for the cannula. The cannula is brought out through the skin and may be attached to the drug delivery system. The operative incision is closed.
Removal of tunneled intraperitoneal catheter. The physician performs removal of an intraperitoneal catheter. The physician makes an incision over the insertion site of the catheter. The catheter is dissected free of surrounding scar tissue, transected, and removed from the peritoneal insertion site and skin exit site. The incision at the insertion site of the catheter is closed. The skin exit site is left open to allow drainage.